So welcome to today's webinar, Great Ideas for Managing Bladder Issues and Enjoying More Confidence and Freedom. And our presenter is Vanessa Colusso, and I'm your facilitator, Nicola Graham. So we like to do an acknowledgement to country, and in the spirit of reconciliation, MSL acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. And we pay our respects to elders past and present. Today's presenter is the very wonderful Vanessa Colusso, and Vanessa has spent 17 years as a registered nurse. She is our clinical nurse consultant in Continence at MS Limited, and she spent the last 8 years working in disability. So I'm going to hand over now to Vanessa to talk about how you can best manage bladder issues.
So hello everyone, and thank you Nicola for the warm welcome and introduction. I've received some feedback from the registration for today's webinar, and I understand that a lot of people are experiencing bladder issues and are interested in learning more about how to better manage their issues, as well as some people who are also wanting to know if their bladder symptoms are related to their MS, which is great because I'll be discussing how MS can impact the bladder, including symptoms you may experience, as well as discussing some treatment options that can provide you with more confidence and freedom to live the life you want. It's important when looking at treatment options to keep an open mind and that you also consider what will best suit you and will ultimately improve your quality of life, because staying at home all the time so you can be close to the toilet or spending hours a day on the toilet is not living, it's surviving. People living with MS are some of the most adaptable and resilient people that I've ever met, and I know this is a hurdle that you can conquer, so it doesn't stop you from living your best life. We're just going to talk a bit about a neurogenic bladder, and I understand a few people are aware of what a neurogenic bladder is. They've heard that term before, but it's a condition in which problems in the nervous system affect the bladder and urination. So it's a very common condition in people living with MS, and it's sometimes referred to as an overactive bladder. So we're going to talk a bit about the urinary system. I'm not going to spend too much time on this though. So the urinary system consists of the kidneys. They process waste and they help keep proper balance of salts, electrolytes, and produce enzymes. And they filter out waste through urine, which is transported from the kidneys down the ureters into the bladder. And the bladder stores urine, and it is released through the urethra. The muscle that is controlling the bladder is called the Detrusor muscle. So that will come up as I go through the presentation, but just know that that is a muscle that is autonomic, so it's not a muscle that we have voluntary control over. So, and that's important to realize when you're looking at incontinence as well, related to a neurogenic bladder. So bladder dysfunction is associated in multiple sclerosis, is caused by the interruption of nerve pathways, impulses that control the passing of urine. So the bladder functionally and physiologically is normal. It is just that the disease process has interrupted those neural transmissions, so the communication pathways from the brain to the bladder. So messages around the bladder being full and needing to empty are confused. The bladder can become overactive and can go into states of spasm, and then it doesn't empty properly. So there are different impacts that this disruption of communication can have on the bladder. So bladder dysfunction is one of the most common symptoms associated with multiple sclerosis, and it can occur at any time in the disease process. So it can occur at time of diagnosis. So it could be one of the reasons that has led to the person becoming diagnosed with MS, or it can pop up later down the track, you could have lived with MS for the last 10, 15 years and not had any bladder issues up until now. So it can happen at any stage. Surveys have indicated that 60 to 90% of people with MS have some level of bladder dysfunction at some stage. So don't think that sitting at home today that you're the only one. There's many people that are experiencing the same issues that you're experiencing as well. And utilising the peer support is also another good function of the MS service that's offered, because it also helps you to understand that it is a common issue and that there are other people living and coping and managing these symptoms and still being able to live a good life. So I just wanted to show you that the impact of quality of life can be detrimental, because if you're not addressing these issues. I understand that can be a fear of incontinence with going out anywhere, and there can also be issues with sleep, constant sleep disruption because you're getting woken because you need to go to the toilet. Sometimes that can be 2 to 3, 4 times a night, and that's not a good quality of life, because that's going to impact on your fatigue the following day. Also anxiety around social outings or going on holidays, so that's going to impact on your mental health as well, because you have a fear of not knowing where the next toilet is going to be, whether you should be drinking enough when you go out, what you should be drinking, and also mobility can change and impact your ability to remain continent, because although you can still identify when you need to get to the toilet, if you're in a wheelchair, there's going to need more time to get to the toilet, and if you have those feelings of urgency that are uncontrollable, then that can impact your ability to remain continent as well. So there are some big impacts on your life with bladder dysfunction that really need to be addressed, because it's not just about going to the toilet. So there are 3 types of this bladder dysfunction associated with an overactive bladder, and that is the failure to store urine sufficiently. So this is the bladder unable to fill properly. So there is a significant amount of urine left in the bladder, so it hasn't emptied properly, and that is an issue because it can lead to urinary tract infections and other medical conditions which aren't good for the bladder or kidneys. And a combination of the 2 types of dysfunction is Detrusor sphincter dyssynergia. So this is where it's failing to store and it's also failing to empty properly. Do we have any questions around overactive bladder at this stage? So these are the different types of dysfunction that can happen with an overactive bladder and MS.
Haven't got any questions at the moment, Vanessa. You did freeze briefly when you were discussing number 2, failure to empty.
Okay.
So I will just ask you to keep your mobile phone on, Vanessa, in case we get another issue in the future, then at least I can call you. But no questions at the moment, unless you want to just quickly elaborate again on number 2. We didn't get a lot of information on that.
Sure, I'll go over that again. So failure to empty, that is where the bladder doesn't empty properly. And so after you've gone to the toilet, there's still a significant amount of urine remaining in the bladder. And this is an issue because it can lead to other sorts of complications, such as a urinary tract infection. So this does need to be addressed and treated. So typical sign of this would be frequent urinary tract infections. Yeah.
So Vanessa, we've had one question in which I think you may have covered to some extent, which is, can you tell which one you might have?
With a continence assessment, and also there's some diagnostic tests as well, you can identify which, yes, definitely. But generally, you'll be diagnosed with a neurogenic bladder, and you'll either have one or more of these issues going on. Yeah.
Great, thanks, Vanessa.
Okay, so some of the overactive bladder symptoms that you will notice if you have an overactive bladder is frequency. So that's going to the toilet multiple times a day. So you could notice that you go to the toilet, but you only go a small amount, and then half an hour later you may have to go again. And also getting up multiple times at night to pass urine is another sign of frequency. Urgency. So this is the sensation that you need to get to the toilet extremely quickly or you're going to have an accident. So like I said before, the detrusor muscle is an involuntary muscle. We don't have any control over that muscle. So if it releases, it releases. And if it does release before you get to the toilet, that's called urge incontinence. And that can sometimes happen with a full empty of bladder, so which is a significant incontinence amount, or it could just be a small amount of leakage, and then you prior to getting to the toilet, and then you're able to go to the toilet as well. So different treatments for an overactive bladder. So there's some medications, and these are anticholinergic medications. So oxybutane, that comes in a tablet or a patch, and these other medications are tablets as well. So what they do is they give you, if they're going to work, I've had people say they've tried these medications and they haven't worked for them, but then I've also had people say that they've tried them and they really work. They give you time to get to the toilet. So they prolong that feeling, that sensation that you need to go to the toilet. So you feel like you need to go to the toilet, but there isn't that urgency along with it. So you have enough time to get to the toilet. Botox injections. These Botox looks at taking away the overactive, so it relaxes the detrusor muscle of the bladder. Now, one of the side effects of Botox, though, is that it can completely stop the bladder from working. So what we need to look at before doing Botox injections is whether the person is capable of self-catheterizing, just in case there is the possibility that the bladder stops working entirely, and then the person needs to manually empty their bladder with a catheter. So when they get that feeling that their bladder is full, the Botox, this is a side effect. It's not intended side effect, but the intention is to relax that muscle to the point where it calms down and is able to function relatively normally. So you're going to the toilet less frequently and you're not having those urgency episodes. But the side effect is that in some cases that muscle does stop working and that the bladder will not empty at all. So it needs to, you'll need to catheterize in order to empty the bladder when you feel like you've got a full bladder. So we need to, prior to this treatment option, we need to look at whether you're physically able to catheterize and you've had some education and you're competently able to do that clean procedure, because there is the risk of developing urinary tract infections if that procedure isn't carried out correctly. Pilates, so increased core strength, and pelvic floor physiotherapy. So these are more related to if you're having any stress incontinence. So pelvic floor muscles, they are the muscles in our groin that support our bladder, and they're the only muscles that we have control over when it comes to continence. So as we age, both men and women lose muscle tone, and those pelvic floor muscles become weakened. And if we haven't used them, then they're at more risk of weakening. So doing pelvic floor exercises and Pilates can increase that core strength, and that can prevent the development of stress incontinence and worsening of continence issues as well. So SNS and PTNS, this is nerve stimulation therapy. These are quite popular treatments but difficult to find someone who's actually doing them at the moment. Botox probably is the most popular treatment option at the moment, but there's lots of research into SNS and PTNS, which is nerve stimulation. So SNS is a surgical implant that is designed to specifically treat the nerves going to the bladder, and which will help reduce those continence issues, such as the urgency, frequency, and sometimes PTNS. So that's posterior tibial nerve stimulation. So this is where a little needle is placed in the ankle close to the tibial nerve. The tibial nerve has been shown to have some impact on the bladder, and there's been research into PTNS, and around 60 to 80% of people with overactive bladders have had their continence, their overactive bladder issues resolved or managed in a way that they become more livable, I guess, more manageable. So in one case, I know of a gentleman who's had PTNS, who was completely incontinent of urine. He became continent, so that was a real great success story. But with PTNS, you're not, it's not a guaranteed therapy. So we're not sure who it's going to work on until you actually trial it. And you'd need to trial that for around 4 to 6 weeks before you actually know if you've got any benefit from that therapy. And these therapies, including Botox, you can all be accessed from a urologist. And also continence products. So continence products include things like pads, inserts, pull-ups, also can include mats that you're putting on car seats, the lounge or beds, and as well as washable underwear. So at the moment, the Modibody underwear is really popular with my clients and my female clients who have some urge incontinence but are still able to get to the toilet with just a small amount of leakage. There is a lot when it comes to these treatments and looking at what best suits you. It's not just about identifying what condition you have, and also what best suits your life and how, but also what you can mentally cope with as well. And sometimes I have noticed females are more open to these treatments than males, and I think that you just need to be open-minded that this will get you living a better life, and you may be able to go out to work rather than working from home. You may be able to go on a family holiday. So don't discount them at first sight. Just keep an open mind is all I'll say. So retaining urine. So if your bladder isn't emptying properly, you're still going to have a lot of the symptoms that we discussed about an overactive bladder. So frequency and urgency are symptoms, and even getting up at night are symptoms that are very common with an overactive bladder, and you'll see them with the different varying dysfunctional bladder issues. But also when retaining urine, you might also have difficulty starting, which is urine hesitancy. So you may be sitting on the toilet for a long period of time before, even though you feel like you've got that urge to go, like you felt like you nearly wet yourself getting to the toilet. As soon as you sit on the toilet, it just won't start for you. So that's urine hesitancy. And also recurrent urinary tract infections is another sign of not emptying the bladder properly. And this isn't something that you have control over. Like if you're going to sit on the toilet for an extra half an hour, it's going to come out. It doesn't work like that. This is the bladder muscle not sufficiently relaxing to empty properly, or it could be an issue with the sphincter as well. And there's occasional overflow, which is incontinence. So that's the inability to control the passing of urine. So when that bladder's gotten too full and it's not emptying properly, then there will be some overflow occurring because it does need to release. So once again, we're looking at medications as the first line of treatment for urine retention. But then if medications fail, the treatment would be either self-catheterization intermittently. So when you need to toilet, that you would catheterize yourself and then dispose of the catheter after toileting, or placing in a permanent catheter where you have the option for the urine to drain freely, or you could put in a valve and turn that catheter off, and just when you felt like your bladder was full or you needed to go to the toilet, you could open the valve and empty into the toilet. But the reason why we need to, if the medications don't work, it is definitely a catheter option, because you can cause damage to the kidneys if the bladder isn't sufficiently emptying properly. Like you can cause increased pressures and damage to the kidneys and scarring, which can impact your kidney function later down the track as well. So you don't want to cause any further damage or any further disease conditions by not seeking the right treatment. So I know catheterization can be really confronting for some people, but just remember it's about giving you the best option to live your best life. And as long as you can grasp your head around that and what freedoms it's going to give you to live a great life, then there can be hours between catheterization and you can freely go out to meet friends, have coffee, and feel confident that you won't need to go to the toilet when you're out. And that, I think, is definitely more of a quality of life and freedom when it comes to living, rather than hanging around a toilet all day and with a fear of leaving the house because of that. So storage dysfunction. So we've got, once again, the urgency, the frequency. So nocturia is waking up multiple times overnight to go to the toilet. and recurrent urinary tract infections. It's a sudden onset of flooding incontinence. So that's when your bladder has completely filled and you've just not been able to get to the toilet and you've just had an incontinence episode. And when I'm talking about incontinence, that's the inability to control the passing of urine. So there's no time to get to the toilet and you can't hold on at all. It just happens. And that's not something that you can control. Getting up at night to pass urine. Most people will sleep through the night and will wake up in the morning with a full bladder and go to the toilet. But most people with MS will wake up at least once. If you're waking up more than once a night, then that's probably an issue for you. So once again, treatment for this type of bladder dysfunction is medication and catheterization. So once again, we're looking at an issue where the bladder isn't able to empty sufficiently, and frequency and urgency and incontinence is having a huge impact on that person's life, and they're at risk of developing other conditions that will impact their health. So catheterization, if medication doesn't work, is the treatment option. So urinary tract infections. Have there been many people here that have had urinary tract infections?
Guys, if you could just pop in the question area if you've experienced some UTIs. We have got a few really good questions, Vanessa, as well. So when you're ready, I'll answer them. So yes, everybody's saying yes, yes, yes. Okay. Only a couple of no's, very occasionally, yes, but not MS related. So a few people are saying no, but 95% of people, and lots of people have answered, which is great, are saying yes, they have had UTIs.
Okay. So urinary tract infection can be a sign that your current bladder management, whatever that is, isn't working, and you need to seek some extra input, whether that's from a urologist or a continence nurse such as myself. Generally, GPs will only treat each infection. So you could have an array of infections, like if you're having more than 4 infections in a year, then you really should be reviewed by a specialist because something is going on and the current management isn't working. And as I said, the GP will just treat each infection. They won't really link them up and look at what is going on because they're more of an acute care service. So some of the symptoms of a UTI are also issues of an overactive bladder, such as the urgency and frequency. So we can't really use those as indicators of UTI if they're symptoms that you experience on an everyday occasion. So other things you need to look at, I mean, even passing small amounts of urine. If you've got frequency, you're always going to be passing small amounts of urine. So what you sort of need to look at is whether your urine is cloudy, whether it's smelly, it's concentrated. I would start making a habit of just after you've been to the toilet, just have a look in the toilet bowl. What does it look like? If you notice that it should be nice and clear, and if you're noticing that it's starting to get a bit cloudy or it's starting to get some debris in it, so you're finding there's little pieces in the urine as well, I can't describe it, then that can be a sign that you might have a urine infection. So getting to know what your urine normally looks like will really help you as a cue when you do get a UTI, because you don't want it to get to the stage where you become really systemically unwell and end up in hospital. So getting on top of them early can be really handy, because it can be the difference between just having a course of oral antibiotics or spending a week in hospital on IV antibiotics. So other symptoms that you can experience is stinging or burning when you're passing urine. You can have some abdominal pain. Sometimes you can get, if the infection has advanced, sometimes you can develop some flank pain, so some back pain. And if you've become systemically unwell, so the infection has really impacted you and thrown you for 6, then you develop a fever as well. And you also notice the worsening of your MS symptoms. So there is some ways that you can identify when you have a UTI, but it's good to know, because some of the symptoms are also common with an overactive bladder, it's good to know what your normal urine is like, so you can identify when you do have a UTI. So some simple things to help reduce infection. So drink plenty of clear fluids. So in people that have recurrent urinary tract infections, for those that drink around 2 litres of fluid a day, their risk of developing a UTI is reduced by 70%. And I know you're thinking, if I drink more water, that means I'm going to go to the toilet more. And you're probably right, but at least you're flushing out anything that is sitting in that in the bladder, and the risk of developing an infection is reduced. So do not restrict fluids. Some people thinking that they that they should drink less during the day will help their bladder symptoms. It's actually doing them less of a favour, because that could impact them developing more UTIs as a result. Adding lemon to water, cranberry tablets or cranberry juice are very good at preventing UTIs. Hiprex and vitamin C. So Hiprex is an antibacterial, so these are all over-the-counter things you can buy at the pharmacy. You don't need a script for these. And Hiprex needs vitamin C in order to activate, so the two must be taken together. Demannos, that is a type of sugar. It's a supplement, and what it does is it only works on E. coli bacteria. But what it does is the E. coli binds to the sugar, and it's the only sugar that will enter your urinary system and will be excreted by the urine. So E. coli, when it gets into the bladder, E. coli binds to it because it's a sugar. It doesn't kill the E. coli, but when you're going to the toilet, it flushes out that bacteria, so it's not hanging around in your bladder. Probiotics are really important, particularly in females, to make sure there is a good genitourinary flora in the system, and keeping antibiotics to a minimum. So there is a prevalence with increased antibiotic resistant organisms in the community, and overusing antibiotics can increase your risk of developing one of those organisms, and really we should only be using them when we have an infection or where a urologist has identified that ongoing use is of benefit to that person. Okay, but I think before we go on, maybe Nicola, if we address some of those questions.
Yeah, we've got some fantastic questions come in, so thank you guys for your questions. I just also want to note we can't respond to all of them, and some of the questions are quite specific to yourself. So I would love to tell you that you can book in for Vanessa. It's a free service if you're in New South Wales, and we also have a continence nurse, Fiona, in Victoria, which you can access through your NDIS, and you can speak to our nurse advisors as well, and that's all accessible through 1800 042 138. I'll give you more details later. So do know you can have free support, and please do book in. Meanwhile, questions we've had are, how many times a day is normal to go to the toilet?
It's very dependent on each person and really how much you're drinking. So if you're drinking only, for a normal person who's only drinking a litre a day, they may only go 2 times to the toilet or 2 to 3 times the toilet in a day. But if you're drinking 2 litres of fluid or more, that could be 5-6 times a day. But what you look at, it's not necessarily, when I do a continence assessment, it's not necessarily you're going 6 times a day. That's one more time than really you should be going. What I look at is overall, how many times a day you're going to the toilet, and because some of the cases you may not even realize how many times you're going, and it's only through the assessment that you may look and say, oh my God, I didn't realize I was actually going to the toilet that much. I had a client who wasn't going out, and she was at home a lot, working from home, and I did a continence assessment with her, and I said to her, oh my goodness, you're on the toilet a lot. And she said, oh my, I didn't realize, I thought I was going less for this assessment than what I do normally. But she was going a lot to the toilet, and I'm talking like half an hour or 20 minutes she was going to the toilet a day. So she was literally living on the toilet. So sometimes we can normalize what's happening to us as well, and you don't realize that there's an issue, or you're minimalizing the issue because you're not really coping with what's happening. And that's all part and parcel with what's happening to you. But you really need to seek some help, because it's not a life to living like this. And yeah, so that's all I'll say about that.
Yeah. Okay, thanks, Vanessa. And it's really reassuring to know that you have got space and people can book in to see you. So I'd encourage people listening to call and book in. So a couple of other questions, just very briefly. One here, when my bowels are full, I seem to be more incontinent. Is that something you can talk about a bit, please, Vanessa?
Yes, so constipation can play a big impact on bladder function, and addressing the two, and generally, although we're not talking about bowels today, that is something that I cover as well, but generally when there is some bladder issues happening, there's also some bowel issues going on, and sometimes that's not picked up by the person initially, and that can exacerbate their bladder issues, and that's the reason why they're seeking some assistance, is because their bladder issues have worsened, but they've worsened because they've developed some constipation, but they've not identified that. So bowels do play a big part, and you can also have an overactive bowel, which is also a neurogenic bowel, and that same sort of process, the bowel isn't impacted at all. It's normal physiologically, functionally, but the neural pathways have been interrupted, so the communication between the brain and the bowel aren't sufficient, so it's not working as well as it should. So that's why people with MS can experience high incidence of constipation.
And we've got a few more questions, but I think it's more important that we move on at the moment. But just a comment here from Mary, which I think many people will relate to. And she says, I usually don't drink a lot of liquids when I go out, and that really helps my urgency and frequency. And I imagine you've probably got a couple of comments to say about that, Vanessa.
Yes, so I am going to talk about that a bit further down the track, but it is something that you can, a strategy that you can use before going out to a social event if that works for you. And because you can make up fluids at another point during the day when you return after your event or your outing. So it's still important to have good fluid intake, but if you're limiting it for an outing or a social occasion, just remember that you're going to have to make it up at some other point during the day. Otherwise, it can still impact your bladder management, and you can even develop, like, you don't want to become dehydrated because that can impact your fatigue and other things as well.
Great,
Okay.
Thanks, Vanessa. We'll leave the questions at that, and we'll carry on with the presentation.
Okay, so what happens in a bladder assessment? So normally, if you will see myself or have a continence assessment, or with myself, or see a urologist or any other continence nurse, what they're looking at is what type of disease you have. They're getting a history from you, and that it can include what symptoms you've had, how long you've been experiencing them, what sort of management you've implemented to deal with it, and for how long, and how successful that's been. Also, data collection. Now, this is really important because although you think you're giving a really good history around what your symptoms are, doing a bladder diary or even a bowel diary, and actually writing down when you're going to the toilet and how much you're drinking in a day, it really puts in perspective, not only for yourself, but for me. I can just look at 1 day's worth of fluid intake and fluid output, what you've gone in the toilet, and I can see exactly what your problems are very quickly. And sometimes when there is some cognitive issues around memory, which are also part and parcel of a lot of neurological diseases, including MS, that history isn't always sufficient enough, and we really do need that data collection. So whether you're coming to myself, or you're going to see a urologist, or you're going to see another continence nurse, you could possibly be asked to do a bladder diary or a bowel diary, and that's just monitoring and measuring what is going in and what's coming out, because it does help identify whether there is whether there is a storage dysfunction, or there's a retaining dysfunction. So it does help give a glimpse as to what that specific issue is for yourself. Diagnostic tests. So these could be ultrasounds, looking at the bladder and kidneys to see if there is any abnormalities with those, which needs to be excluded medically before we look at a diagnosis of a neurogenic bladder. We need to make sure that they are functionally normal. And also looking at, when we do those ultrasounds, I'm sure a few people have had ultrasound of their bladder and kidneys, or even if you've been pregnant and you've had to have a full bladder for the scan. They ask you to go to the toilet, empty your bladder, and then come back and they'll scan you again. So what they're doing after that toileting is they're measuring how much urine is remaining in the bladder. So that's also important for checking whether there's any retaining issues. And a bladder scan can also measure that as well, and we call that a post-residual volume. Also urodynamics. So urologists will perform urodynamic tests to ascertain whether there's any issues with the bladder itself functionally, and they can also check pressures within the bladder and help identify what specific issue you're having and what the best treatment is for that issue. So when we look at a bladder assessment as well, some of the other things that we consider is hand function. So how much mobility you have in your hand, sensation, and whether you have any feelings of numbness or tingling. And the reason why we do that is because there is that possibility that you may require self-catheterization as a treatment option. So we need to consider whether that is a possibility for you to functionally complete. Mobility. So we're looking at, when we're considering options, treatment options for you, we're looking at your mobility and what is going to lead to the most successful outcome for you. So giving you a toileting regime, if you're in a wheelchair and it takes you 15 minutes to get to the toilet, that might not be as ideal as another option. So considering that as well. So your lifestyle. So are you working from home? Are you having to go into the office all the time? Do you work full time? Do you look after kids? Do you like to go on holidays? Do you like to go out once a week, twice a week? What's your lifestyle and how can we improve it? And what's the life you want to live? What would you like to achieve in your life moving forward? Because MS isn't a condition that we want to, that is something that needs to hold someone back. And this is the point of accessing treatment options, is to give people their life back, because I know that it can be a huge impact on the quality of life if you're sitting at home and not doing anything with your family, or not going out with friends because you've got the anxiety of having an incontinence episode, or of not knowing where the next toilet's going to be located. And motivation as well. So I know some people come to me with, where they're at their wits' end, they can't cope anymore. But when they hear the treatment options, they're also not at that stage to accept some of those options, and that's okay. But it's also, I think, something that you sort of need to grasp mentally as well, because these issues, if you have them, they're not going to go away, and it's something that you're going to have to address as part of your MS in order to move forward in life and have a good mental health and a good lifestyle. So do we have any questions on a bladder assessment? I haven't scared too many people off.
You don't have questions on bladder assessment. We do have a couple more questions, but because we're at 11 o'clock, what I'd like to just indicate to people is we'll be about another 5 minutes and we'll squeeze in some quick responses to some of the questions just very briefly. So please hold on. And just a reminder again, you can book in with Vanessa. So call MS Connect to do that.
Okay, so some basic things you can do to help bladder problems is just look at how much caffeine and alcohol you're having in a day. So these are stimulants, and they're going to actually increase your frequency episodes. So if you're going out on a social outing, maybe look at a decaf coffee or a mocktail, or if you're not happy with that option, just be mindful that having these drinks before going out or while you're out could increase your need to go to the toilet. So reviewing your fluid intake, so that's looking at, you know, you can restrict your diet, your fluid intake prior to an outing, but then you're going to have to plan and make sure that you're making up for that later in the day. Avoiding constipation, because that will impact your bladder issues. And try to do one change at a time. If we all do too much at once, you don't know what's worked. So just do one thing at a time and see if that works for you. Changing diet and exercise can help, or talking to your doctor or MS nurse or continence nurse. And some good principles for bladder management. So a good bladder management program must be effective, practical, reliable, socially acceptable. So looking at what you've currently got in place, do these goals, actually, are you meeting these with your current bladder management? If not, then you probably should be seeking some further advice. And it's also, so when you're looking at treatment options, rather than go, oh, I can't cope with these options at the moment, I'm just not got in the right headspace to deal with extra medications or catheters. You also, and you think you can just manage by staying at home and staying on the toilet and just continue the way you are, you also need to consider that you need to preserve your normal kidney function and prevent overstretching of your bladder. And you need to control infections and other complications that can occur if treatment isn't sought. So it's not about just maintaining your current norm because that's okay for you and your family. It's also looking at your health and what's best for you in the long run, because you don't want to do this now and develop a further complication down the track. Okay, and social awareness. So I'm not sure if anyone's aware, but we have a national public toilet map, and you can access that at www.toiletmap.gov.au. And these will tell you anywhere in Australia where there are public toilets. So if you're planning on going on a holiday or you're planning on going on a road trip somewhere, you can map out where you're going based on location of public toilets. So definitely know where they are. That is going to reduce your anxiety when you go out. So, and you're going to have plans around holidays and social outings, reducing fluid intake prior to going out, but then making sure that you're planning to increase your fluid intake at another time during the day. Limit caffeinated and alcoholic drinks because these will stimulate the bladder and will increase your frequency. And utilize treatments and continence products. You don't have to do it alone. And please don't be embarrassed or ashamed about what you're experiencing. Many people are experiencing the same things, and there's help out there for you. So all I can say is just pick up the phone and call someone and reach out. And that's the end of my presentation. Nicola, if you'd like to take over.
Vanessa, thank you so much. We've had lots of questions, lots of people really engaged. I think people are really starting to appreciate that there are a number of things that they can do if they're willing to open their mind to some of those interventions. So Vanessa, one of the main questions we've had is again a reminder of how do they book in for the service? Is it free or is there a charge? Yeah. Could you run through that for us, please?
Yeah, definitely. So in New South Wales, you can contact MS Connects. The number is in the slide there, and just say you'd like to make a booking with the Continence service, or you can name me, Vanessa Colusso, and I can contact you to access service that way. If you're not in New South Wales, so in New South Wales, my program is only available to people in New South Wales because it's funded by New South Wales Health. It's a free service, so it's not billed under Medicare or NDIS, so anyone can access it so long as they live in New South Wales. Anyone living outside of New South Wales, you can contact the MS nurses, or if you're in Victoria, Fiona Easton is the Continence nurse there. If they have issues with your specific case, I have had instances where they have contacted me because they've just needed a bit more information, and I've assisted people living in Victoria or another state on a case-by-case basis if that has been needed. Yeah.
That's beautiful. Thank you, Vanessa. It's so lovely to know that your service is available for people to book into with that 1-800-042-138 MS Connect number, and encourage people to reach out and get the support and help they need so that they can have a bit more freedom and a bit more confidence. So huge heartfelt thanks. Lots of people typing in and saying thank you. A few people will be following up separately with handouts and a few things, so I will follow up on that. Thank you so much, Vanessa. I'm just going to take the screen back.
Thanks, everyone.
Okay, so just some very brief housekeeping to finish up with. So hopefully you can all see. I'm just checking. Yep, you can see my screen. So I just want to remind you lots of services that we have to help you, including NDIS and My Age Care. We have support coordination, as Vanessa has mentioned, that MS Connect service with specialist advice and help and nurse advisors, social workers, etc. We have employment support, very important peer support, education, residential care, etc. So do reach out if we can help you in any way. Lots of great resources. We've got a podcast on bladder as well, so you can listen in your car if you'd like to. And we have our webinar library with a webinar on bladder as well. So do feel free to have a look at those if they'll be useful for you. And as we've mentioned, there's our MS Connect number 1-800-042-138. Don't hesitate to call if we can help. So thanks very much for your time today, and a huge heartfelt thank you to Vanessa. And we will get back to any questions we haven't answered, and I will send a recording to all of you so you can review it again if you'd like to, or you will be able to access it on our website shortly. Thanks very much, guys, and see you at our next webinar. Take care. Bye, Vanessa.
Bye. Thank you, everyone.